Hi everyone, my name is Melanie Grant and this is C&M Glass. This is our part 2 video this week for our 2030 class in discussion of surgical procedures to the musculoskeletal system, senses, and operation microscopes. And this is our second video talking about our senses and operation microscopes. Some of our key points, we're really going to talk just a couple of procedures done in the optical and auditory system and some of the labeling and identifying where you're at. We'll also talk a little bit about that operation microscope and when to add that procedure. So we should be looking at sections 2513 and then 2515 of our coded textbook, where we have our optical and auditory systems for 2513. The first thing I want to remind students is to always learn your labeling and parts of the eye, as well as labeling and parts of the ear. This is especially important in this body system because a lot of the procedures done will talk specifically about where it's done to and what they're doing. And so it's up to you to identify what exactly are we talking about and where are we at. You'll also note that most of your eye procedures will actually be done outside of a medical profession and more specifically with a specialist in vision or an ophthalmologist. In those cases, you're not going to see a lot of eye procedures done in a regular surgery unit, but you may see certain things such as foreign body removals, vitrectomies, and dacryocysto-rhinostomies, which are procedures done specifically for medical reasons and therefore will be done in a medical setting. Most insurance companies don't like to pay for eye services. So it's very important that you identify what it is that we're doing and why to support the medical need. Okay, so to start with, we want to look at the definition of a foreign object in the eye. Well, a foreign object in the eye can be anywhere within the eye, and so the question is, does it protrude or is it somewhere on the external part of the eye, meaning that there's no cut or incision into the eye itself. You'll notice here some examples for removal of foreign body, external eye, conjunctival or superficial, meaning that it went into the first layer or so of the eye, but it didn't actually protrude into any part of the eye itself. This can happen from pretty much anything that gets in the eye. Sometimes a patient may come in with glitter in their eye. Yes, it is a thing. There's a lot of people who like to put glitter around their eyes, but there's specific type of glitter that will not damage the eye. And if they get an actual piece of, say, crafting glitter, and they get that into the eyeball, it can actually cause some severe damage and irritation traumatically and may need to be removed. Other things such as specks of dust that may contain a variety of debris in the air, if some of it gets into their eye and causes continual discomfort and is not able to be flushed out, that could be another example of how that happens. You have further into the eye where you talk about orbitotomies without bone flaps, so that you're going into the orbit around the eye. And then removal of foreign body or dacrylith lacrimal passages. And so below the eye and next to the nose is this little tear ducts called the lacrimal ducts. And if something gets into the eye and into those ducts, they may have to go in more scopically and look at that to get it removed. Talking about the tear ducts for the eyes, you have patients who are considered to have an NLD stenosis, which is another medical condition. So you have a nasal lacrimal duct stenosis, or NLD, and that's where the same duct that creates your tears is smaller than it needs to be. And so a lot of patients will have issues with tears and chronic dry eyes and possibly dry noses and various discomforts as a result. It can even get so bad if it's clogged by backed up tears or backed up debris from the eyes, then they may need to do foreign body as well. So what they'll do is they'll go in. It's performed from a percutaneous approach by way of facial incision. So what they're meaning is the provider does a endoscopic approach and cuts directly into that section right here to get into the eye. Not exactly pleasant. You have a couple of different codes for that. In this example, you have dilation of the lacrimal punctum with or without irrigation versus probing of the nasolateral duct with or without irrigation with insertion of tube or stent. So a tube would be inserted there if they wanted to keep that open, whereas if they just dilated it and kind of flushed it out, you would be using the first code here. So you have a couple of examples there, and these are really kind of straightforward in terms of identification of where you're at. The most important thing, again, is to be able to identify the different parts of the eye. And you have a great definition of the eye parts on page 774. And in your CPT code book, let me see if you have some eye exams here. Okay. So I'm just going to look and see if we have any diagrams under the eyes for help in identifying those different parts. Okay, so you have your surgical section for eye and ocular adnexa, which starts on page 421 of the 2018 CPT Code Book for Professional Edition by the AMA, which is the edition that's recommended for this class. And you have procedures to the eyeball, anterior segments, and posterior segments. And yes, you do in fact have a definition of the eye anatomy here on that next page to identify the different labeling. Pay special attention to this when you're looking at procedures in identifying what part. You also have ocular adnexa and conjunctiva listed here. Now, there's no specific guidelines for your eyes aside from in-text guidelines, so you don't have a specific section here. Just pay attention if there are any in-section guidelines because you will see those. Last but not least, one of the ones I see commonly in a surgical field is intraocular lens procedures. This is where the patient is no longer able to see very well for whatever medical reason, and we go in and we replace the lens. Now, just like a lens with a camera, the lens is what allows our eyes to focus and create clarity in our vision. And so what we will do is we'll go in and we'll slice open the eye, remove that lens, and put a new one in there. Oftentimes, keep in mind this will include all parts of that procedure. I think that's one of the ones that gets most complicated is when we're doing the incision and the removal. We want to remember that some of this will be considered combined, and always read further to make sure that you get everything that's done. Okay, so moving on to our ears and auditory system, which is page 437 of the CPT code book, and also has a very lovely definition of the anatomical parts of the ear. The biggest thing when you're looking at the ear is identifying what part of the ear are we doing procedures to. Now, unlike the eye, where most of your procedures are considered not medical but vision, with the ear, a lot of the auditory procedures are coded directly under medical section. So we want to make sure we always identify what parts of the ear our procedures are to. Our external ear is very specific to anything external. And you have your definitions on page 777, which include the auricle, the external acoustic meatus, which is also known as the external auditory canal, and the eardrum itself. So here's that canal, and this being the eardrum or the tympanic membrane. Past that, you have your middle ear, which has the auditory ossicles, malleus, incus, and staples, the oval window, and the eustachian tube itself. Okay, so that's just kind of like all of this here. That's your middle ear. And then for your inner ear, you go further in. Here, you have a little cochlea and the semicircular canals. So I probably made that circle here a little too big. It should go, let's see. Okay, so about right here is your middle ear, and then your inner ear is there. Okay, so yeah, I made that circle way too big. Okay, so in middle ear is including the eustachian tubes. Eustachian tubes may sound familiar because they are one of the most common types of procedures that you'll hear about, especially with kids, where they go in and they get a eustachian tube replacement. So patients who are constantly getting middle ear infections, they're getting a lot of gunk and infection filling up inside the ear. And this can cause a lot of problems such as hearing loss, as well as dizziness and vertigo and difficulties being able to really function. So when that happens with middle ear infections, if a patient has it chronically enough, they'll go in and they'll put little tubes into those eustachian tubes to kind of keep them open and keep them from getting full and gunky. Now, you have different services, and just like we go from head to toe with the ear, we go from outer to inner. And so we have external, middle, and inner ear procedures, followed by temporal bone middle fascia approaches. Now, this is one of the few sections where you have a bone, such as the musculoskeletal, that's found under a different area, and in this case, in the ear, because it's a very small bone, and it's only going to be found within the ear. All right, then last but not least, we have on page 442 the add-on code for an operation microscope. You'll notice if you look at section 2515 of your textbook, it talks about an operating microscope, and it has a list of the codes this can be an add-on to. Now, what this is identified as is a surgical microscope is employed when the surgical services are performed using the techniques of microsurgery. Code 69990 should be reported without modifier 51, in addition to the code for the primary procedure. You do not use it for visualizing with magnifying loupes or corrective vision. Do not report it in addition to procedures where the use of a microscope is already inclusive component. So if the procedure already says use of a microscope, we don't add code 69990. Only if a procedure does not indicate the microscope is used, and you have a small list of them on page 785 of your textbook, as well as a reference of which ones not to use it with on page 442. So it gives you a little bit of information here and a nice little piece. So keep in mind when you're using the operating microscope, it's something for identifying procedures to the eyes and ears, and a couple others, and you'll notice that here in your textbook. As with all add-on codes, it has a symbol before the code, which is that plus symbol, meaning that it is an add-on procedure and must be added to the main procedure or surgery you're doing. And just the fact that it is an add-on code should tell you not to add modifier 51. That's all I have for the second part of this week's learning, talking about senses and operation microscopes. Remember, the most important thing with these two sections are identifying the different parts of either the eye or ear and where that procedure is being done. Until next time, we'll talk to you soon.